Kidney cancer, also known as a renal cancer, is a type of cancer that begins in the kidneys, which are two bean-shaped organs responsible for filtering blood and producing urine. The most common form of kidney cancer is renal cell carcinoma (RCC), accounting for around 90% of cases. Other less common types include transitional cell carcinoma and Wilms tumor, more common in children. Types of kidney cancer: renal cell carcinoma (RCC). Most common type. This cancer begins in the small tubes, tubules within the kidney that help filter blood. Subtypes includes clear cell RCC, the most common subtype papillary RCC, and chromophobe RCC. Transitional cell carcinoma (TCC) starts in the ureter. This type of cancer originates in the renal pelvis, where the kidney joins the ureter, the tube that carries urine to the bladder. Wilms tumor. Childhood cancer. This is the most common kidney cancer in children, typically affecting children under the age of 5. Renal sarcoma. Rare. The rare form of kidney cancer that affects the kidney's connective tissues. Causes and risk factors. The exact cause of kidney cancer is not well understood, but several factors increase the risk. Smoking. Strong risk factor. Smokers are at significantly higher risk of developing kidney cancer compared to non-smokers. Obesity. Excess weight. Obesity increases the risk due to hormonal changes and increased inflammation. Hypertension. High blood pressure. Linked to increased risk. Chronic high blood pressure has been associated with a higher likelihood of developing kidney cancer. Family history. Genetics. The family history of kidney cancer, especially in close relatives, increases risk. Chronic kidney disease. Reduced kidney function. Patients with long-term kidney disease or those on dialysis are at greater risk. Inherited genetic syndromes. Von Hippel-Lindau (VHL) syndrome, a genetic disorder that increases the risk of kidney cancer and other tumors. Occupational exposure. Exposure to chemicals. Certain chemicals, such as asbestos, cadmium, and specific herbicides, are linked to kidney cancer. Age and gender. Older adults and males. Kidney cancer is more common in men and in individuals over the age of 50. Symptoms. Kidney cancer often does not cause symptoms in its early stages. When symptoms do appear, they may include blood in the urine, hematuria. Most common symptom. Blood in the urine can appear pink, red, or color-colored. Back or side pain. Persistent pain, dull or sharp pain in the lower back or side, just below the ribs. Unexplained weight loss. Sudden weight loss. Significant and unexplained weight loss may occur. Fatigue. Persistent fatigue, feeling unusually tired or weak over a prolonged period. Fever. Intermittent fever. Recurrent fever that is not caused by an infection. Lump in the abdomen or side. Palpable mass. The lump or mass may be felt in the abdomen or side. Other symptoms. Loss of appetite and night sweats. Diagnosis. If kidney cancer is suspected, several tests and procedures are used to confirm the diagnosis. Imaging tests. Ultrasound can help identify abnormal growths in the kidney. CT scan or MRI provides detailed images to assess the size and spread of the tumor. Bone scans may be used to check for cancer that has spread to the bones. Urine and blood tests check for abnormalities. Urine tests can detect blood, and blood tests can check for kidney function or cancer markers. Biopsy. Tissue sample. A small sample of kidney tissue is taken to determine if cancer cells are present. Cystoscopy. For transitional cell carcinoma, a small camera is inserted into the bladder and ureter to check for signs of cancer in the urinary tract. Staging. Once diagnosed, the cancer is staged to determine how far it has spread. Stage 1. The cancer is confined to the kidney and is less than 7 cm. Stage 2. The tumor is larger than 7 cm but still confined to the kidney. Stage 3. The cancer has spread to nearby lymph nodes or blood vessels. Stage 4. the cancer has spread beyond the kidney to distant organs, such as the lungs, bones, or liver. Treatment options for kidney cancer depend on the type, stage, and patient's overall health. Surgery. Radical nephrectomy, removal of the entire kidney, sometimes along with nearby tissues or lymph nodes. Partial nephrectomy, only the tumor and a small portion of surrounding tissue are removed, preserving the rest of the kidney. Targeted therapy. Medications, drugs that specifically target cancer cells, such as tyrosine kinase inhibitors (TKIs) or VEGF inhibitors, can help stop cancer growth. Immunotherapy. Boosting the immune system, drugs like checkpoint inhibitors e.g. nivolumab help the immune system fight cancer cells. Radiation therapy. For symptom control, used to relieve pain or discomfort from tumors that have spread, though it is not typically the primary treatment for kidney cancer. Cryoablation and radiofrequency ablation. Alternative treatments. These minimally invasive techniques destroy the tumor by freezing cryoablation or heating radiofrequency ablation of cancer cells. Active surveillance. For small tumors, in some cases, small kidney tumors may be monitored closely without immediate treatment, especially in older or frail patients. Prognosis. The outlook for kidney cancer depends on the stage at diagnosis and the patient's overall health. If caught early, localized kidney cancer can often be cured with surgery. The 5-year survival rate for early-stage kidney cancer is relatively high, around 75 to 95% for stage 1. However, advanced or metastatic kidney cancer has a lower survival rate, particularly when it has spread to distant organs. Conclusion. Kidney cancer is a potentially serious condition, but early detection and treatment can greatly improve outcomes. Surgical removal of the tumor is the primary treatment, while newer targeted and immunotherapies offer additional options, particularly for advanced cases. Regular monitoring and screening are important, especially for individuals with risk factors such as smoking, hypertension, or a family history of the disease.